Good afternoon, everyone, and welcome to today's webinar. So I'm Carla D'Angelo. For those of you who don't know me, I am the project manager at EURO-NMD, and I'm joined today by Dimitrios Athanasiou, which I think most of you know already. So Dimitrios is the board member of the World Duchenne Organization and also member of the Patient Advisory Board of the EURN. So in today's webinar, we are going to talk about the EURO-NMD registry and its federated infrastructure, the EURO-NMD Registry Hub. The hub, which allows to connect the central registry to other existing registries, enabling jointly analysis across different systems. So I think before we even start the webinar, maybe I would like to ask Dimitrios to explain us why a clinical registry, as we traditionally know it, is not enough on its own in this purpose of the EURO-NMD network.
Thank you so much, Carla. First of all, I'm very happy because you see we keep the microphones open, so we are very transparent and open in our EURO-NMD in general. I would say that what we experienced in our rare diseases, I come from Duchenne, but everybody else, I think it's in the same boat. For example, in Duchenne, we had, and we still do have something like 70 registries, patient-driven, clinician-driven, hospital-driven, that are not talking to each other. And this is something that's crippling our care, that's crippling our development. And although the EURO-NMD registry is essential, and it's the central registry is a very good tool, it is for clinical data, for care, as you said, of our people, but the centers of the EURO-NMD do not cover all our patients in neuromuscular diseases. And given that we have budget limitations, so for example, the budget that was given for this EURO-NMD Registry Hub, it was really limited comparing to the budget that we use in our disease-specific registries. We had to think out of the box. And this is the difference, let's say, between this registry and the other registries is co-created. So the patient organizations co-funded the registry by 50% together with the commission. They also are part of the governance, which is also very important and very rare, and that makes the registry unique. It's not a panacea, so it will not save all, but at least it provides a central technical hub that various data inside and outside our NMD community can connect, and can connect cheaply. So I don't want to tire you anymore from this, but I think everybody can understand the importance. We all experience problems with the data, and I will pass back to you, Carla. Thank you.
Yeah, thank you, Dimitrios. And as we will see, this is a very particular feature of the EURO-NMD registry. So with us today as speakers, we are delighted to have Nawel Lalout. Nawel, she's a fair data expert, and she's also the coordinator of ERN registries at Radboudumc University. And also as a speaker, we have today Dagmar Wandrei. She's the IT specialist and data manager at the University of Freiburg. So after their presentations, we will have a Q&A session. So please don't hesitate to type in your questions in the chat box. Please also note that this webinar will be recorded. And so now, without further ado, I will give the floor to our first speaker, Nawel Lalout. Please, Nawel.
Thank you very much, Carla. Hello, everyone. Well, thank you for having us. We've prepared, okay, not that. So that's moving. We've prepared two parts for you. We kept it simple. We're going to look into the Registry Hub. We give you more information, but also we're going to visit the verification and try to shed more lights on those efforts. And Dagmar will take over and we'll talk a little bit more about the registry itself. We've taken into consideration your questions whilst we were preparing this presentation, and we try to answer as many as possible. But at the end, we can also take on a few questions in the Q&A session. So for the Registry Hub in particular and the verification efforts, my starting point is that the fact that the registry was made fair is a considerable advantage in realizing the EURO-NMD Registry Hub. And this is very important to touch on it in this first part. And I would like to go back a little bit in the history, because by now most of you will know what FAIR is, or what the acronym actually means. I don't know why this is not moving. So it started with the analogy of an airport. So in an airport, you have people, you have data, you have planes, which are data users. They are humans and machines. So planes collect the correct people from the correct place with few errors, hopefully. Passport control ensures that people only go to places they are allowed. Any airline can pick up any authorized person from any airport, and normally everything should happen smoothly. So if this happens for humans, so why can't we use this concept for data? And this is how the first workshop was put together, was developed and organized in Leiden University in the Netherlands, Leiden in the Netherlands, so 10 years ago. And it grouped all the experts in these methods. It was a global initiative around improving data reusability and supporting professional data publishing, discovery, exchange, and reuse. What followed is so they came up with 30 core requirements that they've organized in 4 categories: defindability, accessibility, interoperability, reusability, and this is how the acronym FAIR came about. And what followed 2 years later is the famous scientific paper. And in this paper, there is a focus on the machine knows what I mean, enhancing the ability of machines to automatically find and use the data. And this is what we are doing in the Registry Hub. So findable, for those who don't know, means that healthcare professionals can see what data exists and find it. Accessible means that once they find the data they were looking for, they clearly know if they're authorized to use it. Interoperable means that records written in different languages and formats can be combined. We can't combine French, Dutch, and Swedish, so we need a specific language for machines. Reusable means that data can be used more than once for research, but also by healthcare professionals, regulators, families, and patients themselves. So this is in a nutshell what the letters of the acronym mean. The value of why we're doing this is because we would like to answer in the Registry Hub complex questions related to neuromuscular diseases by accessing multiple sources automatically by using machines. And this is why we use the terms data visiting rather than data sharing, because in fact, in the Registry Hub, data stay at source in the actual locations, and only the question travels to the data source. Now, before we share and before we answer questions, we need the data. So EURO-NMD registry has 3 options, and I'm showing you here 3 options. The first one on the left is the centralized approach, where you enter data manually. You enter directly into the registry, you enter the data directly into the registry. But you can also upload a file in a CSV file, should you wish to do that, by extracting data from an existing registry and sending the file to the ERN registry. There is another approach which we call decentralized, and this decentralized is in the instance where you can't enter data directly into the central registry. For example, in the case of a patient-led registry, then you can connect to the EURO-NMD Registry Hub through verification and through interoperability. And this is what I will be showing you with one specific example. So this hub, this cloud, in fact, is a network, a large network of EU registry, NMD registries, databases, including the ERN central registry, includes the central database. We prefer not to use the word central because all these network and networks of networks matter in the data analytics in the middle. The whole point of this federated infrastructure is to answer complex questions and receive responses automatically through machines. So To put all of this in context with one example, I'm going to use the case of a patient, and I'm deliberately using a female with Duchenne muscular dystrophy. Her name is Lizana. She's 24 years old. And I'm deliberately choosing this example because females with Duchenne are very rare. So her data need to be made fair. So how do we go about it? So first of all, Lizana is registered in a Duchenne data platform. This is a patient-led registry. This is what we call having the raw data. So the raw data is stored in a platform, but we need to make her data fair before being able to join the Registry Hub. So this fair transformation, we need to use a solution that we called fair in a box. And this has 3 steps. First, we need to extract the information from the source of the database. Then we need to send it to receive a series of transformation. And finally, the outcome would be a different file called RDF for fair data resource description framework. This is the language for machines. So in a nutshell, this procedure takes 3 steps. We extract data, we transform it, we send it in a different file to be stored in a different place. So this is what happened. We move from Duchenne raw data into Duchenne fair data, where we store this fair data in a different repository. Here, the metadata is open access because the machine need to find information about the data, about the registry itself, but access to the data itself is closed, pending authorizations, approvals, and things like that. And then, so you might ask yourself, how can fair data in the ERN Registry Hub make a difference to Lizana? So Lizana has, she's registered in the Duchenne data platform. We've done the verification, and we have a fair repository where we store fair metadata and fair data. Then Lizana might ask herself, how many people have the same symptoms as me? This question has already been pre-validated by the ethical committee at EURO-NMD. And this query can be sent automatically to several registries or databases. In the middle, we have the FAIR repository for EURO-NMD, and the others are the pilot registries that have been already connected to the registry, ERN registry, through interoperability. And that question will go to all these resources and where the results will be aggregated and an answer sent back to Lizana. This example is also valid for the hospitals. They do the same thing. If they transform their registries and into FAIR registries and they connect it to the hub, they can ask a question such as, which neuromuscular registries have patients recorded with myotonic dystrophies? Then the queries are sent in different hospitals, in different countries, and where the results are again aggregated and sent back to the researcher or clinician that asked that question. So Lizana is in fact a real patient. She is an aspiring screenwriter, digital television production professional, and a young woman living with Duchenne muscular dystrophy. And I have the pleasure of meeting her, and I asked her, if you had an opportunity to access a lot of data, what would you like to know? And she said, which surprised me, I want to find others in the same boat as me. She didn't want to know how to cure her disease or how she could walk. For her, what was important is not to feel lonely with her disease. So this is why it's important to do all these activities and to connect as many registries and data resources as possible in EURO-NMD Registry Hub. So how do we make this happen? So for registry that wish to join the hub, they need to be made fair. So that data are findable, accessible, under well-defined conditions, interoperable, so that information about the same topic can be combined and reusable. So this step, you can't avoid it. to have transformed their data into machine language format. This is very important. Information about the same disease cannot be combined if different languages are used. Machines need their own coded language. This helps the interoperability and automatization. Then we have to deploy a few technical components, and here I don't want to go all technical in this session. Those components need to have the exchange information on the web through API calls. We need the privacy-preserving interface. All of this happen in a secure environment, not out there on the internet. So questions that matter to patients could be asked by directing them to all fair neuromuscular diseases registries. This is how all participating registries in EURO-NMD registry and the Registry Hub can make a difference. So this was my part on the hub, in a nutshell, what it is, the verification with one example. Dagmar will give you now more information on the registry itself. So over to you, Dagmar.
Thank you, Nawel. I hope my audio is working. You hear me well?
Yes.
Yes. Okay, thank you. So my presentation for today is an introduction to the EURO-NMD registry. I am a data manager for the registry, and let's start by again explaining the relation between the EURO-NMD registry and the Registry Hub. So now that we have gained an insight into this big picture with the many data sources distributed around the world, like the Duchenne Data Platform, SmartCare, and so on, that are to become interoperable via the EURO-NMD Registry Hub, let's focus on a very specific data source in the hub, the EURO-NMD registry. In other words, the following presentation is about one particular database, the EURO-NMD registry, highlighted here with the orange magnifying glass. Let's zoom in. I will say next slide, thank you. So I will begin my presentation by explaining what the EURO-NMD registry is and why patient participation is crucial to its success. Next, we will explore how the registry operates, including the legal basis for data processing, the data sharing agreement, pseudonymization, and the patient-informed consent process. We'll then move on to the governance structure of the registry, focusing on the roles of the steering committee and the data access committee. After that, we will cover how data access is managed, followed by an update on the current state of the EURO-NMD registry. And then finally, we'll highlight the benefits for patients and their families and explain how you can get involved in this initiative. Next slide. So the European Reference Network for Rare Neuromuscular Diseases has designed and leads a comprehensive database to collect patient data on rare neuromuscular diseases, the EURO-NMD registry. This initiative supports their mission to improve the diagnosis, treatment, and care of neuromuscular patients. The database collects a variety of data, including the care pathway, medical history, symptoms, genetic information, and the overall care situation of patients. Stop, please go back. The registry is fair by design because we attached great importance to using established classifications and ontologies when designing the database. We made sure that we are interoperable with well-established data models developed by the European Joint Programme on Rare Diseases, and the data items collected make it possible to determine key performance indicators for assessing the quality of care. The EURO-NMD registry is implemented in REDCap, that is a secure web application for building and managing online surveys and databases. It is hosted by the Medical Center University of Freiburg in Germany. And the registry work package for the current funding period is led by Professor Jan Bent-Kirschner, the medical director of the Department of Neuropediatrics and Muscle Disorders here in Freiburg. Next slide. Now, why is patient participation so important to us? Patient data plays a crucial role in driving research and advancing treatment options. It enhances our understanding of disease progression and patient needs. And your contribution is vital in shaping the future of care for individuals with neuromuscular diseases. Next slide. The enrollment process for patients for the EURO-NMD registry is straightforward and easy to navigate. The treating healthcare provider informs patients about the EURO-NMD registry and provides them with the patient-informed consent forms for data collection. Patients then have the opportunity to decide whether they consent to participate and specify which aspects of the data collection they agree to or do not agree to, including who may use their data and for what purpose. Once consent is given, the healthcare provider transmits the data to the EURO-NMD registry. Throughout this process, strict data privacy, security protocols, and governance measures are in place to protect patient information. Next slide. For the EURO-NMD registry, a data sharing agreement is established between healthcare providers, EURO-NMD coordination, and the project partners. This agreement defines the rights, obligations, and conditions for participation in the registry. It covers important aspects such as the lawfulness of processing registry data, the rights of data subject, the security measures in place, the transfer of registry data, and the duration of processing, data storage, and data disposal. Additionally, the data sharing agreement outlines the data access policy, ensuring that all data users and project partners understand and adhere to the necessary protocols. Next slide. According to the data sharing agreement, data ownership is clearly defined. Patient data is under the control of patients themselves, who provide explicit informed consent before their data is shared with the registry for the agreed-upon purpose. Patients retain all rights and maintain full control over their personal data throughout this process. Next slide. Pseudonymization is a key aspect of data protection in the registry. A pseudonym, which is a sequence of letters and numbers, replaces all identifiers that relate to a patient, as for example, their name. This means that from the data stored in the registry, it is not possible to determine to whom a particular record belongs. Only authorized healthcare professionals have the ability to re-identify a record in the registry and link it back to a natural person. The lists that allows for re-identifications are always kept locally at the healthcare providers and are never shared with anyone. Next slide, please. The patient-informed consent is an agreement between the patient and their healthcare provider. Patients have the right to change or withdraw their consent at any time without providing a reason, and doing so will not affect their future medical care. The patient-informed consent includes the idea of the approval from a local ethics committee and provides clear explanations about how the patient's data will be used. It outlines the rights of registry participants, including optional consent conditions. For instance, patients can decide whether or not they agree to the usage of data for commercial projects aimed at improving healthcare, to the transfer of data to non-EU countries in compliance with EU GDPR, and to the potential linkage of data to other existing data sources. Additionally, patients can decide whether or not they want to be contacted about research projects that relate to their condition. Next slide, please. The steering committee serves as the main governing and decision-making body of the EURO-NMD registry. It provides oversight, guidance, and strategic direction for the registry's activities. The committee is led by the coordinator of EURO-NMD, Teresina Evangelista, and includes many members from partner organizations within the EURO-NMD registry consortium, such as healthcare providers and patient organizations. Additionally, the steering committee includes one representative from each of the EURO-NMD thematic working groups and one representative from the Patients Advisory Board. Next slide. Besides the steering committee, the second important committee for the EURO-NMD registry governance is the Data Access Committee. The Data Access Committee plays a crucial role in managing access to the registry's data. It reviews and assesses requests for data access by considering several factors, including the type of the data requested, whether it is aggregated or pseudonymized subject-level data, and whether the request is for the full data set or a data subset. The committee also evaluates the nature of the requester and the purpose of the request. In doing so, the Data Access Committee ensures that the process is transparent, fair, and in full compliance with data protection regulations, the data sharing agreement, and the patient-informed consent. Additionally, the Data Access Committee reviews and validates the data evaluations or queries that will be utilized within the EURO-NMD Registry Hub. Next slide, please. Several stakeholders are entitled to request registry data from the Data Access Committee. These include patient organizations, researchers who are contributing to the EURO-NMD registry, and patients who have contributed their own data to the registry. Additionally, non-contributing researchers, pharmaceutical companies, health authorities, policy, supervisory or regulatory agencies, payers or insurances, non-governmental organizations are also eligible to request data of the registry. Next slide. As a patient, you might want access to your data for several important reasons. Access allows you to ensure that your data is correct and complete. Additionally, sharing your data with other healthcare providers can improve the quality of your care. Furthermore, having access to your data can help you gain better understanding of your current situation and the possible future course of your condition. As for how you can access your data, patients in the EURO-NMD registry will not receive direct access to the system. However, you can contact your responsible healthcare provider at any time to request an export of all data stored about you on the system in accordance with EU GDPR regulations. Such a data export is easy for the HCP to carry out, and we provide corresponding instructions and documentation. The data can be easily exported into various formats such as PDF, CSV, and many others. Looking ahead, there is a goal to develop a patient portal that would allow patients to access their data and complete self-reporting surveys directly on the web. A successful pilot for this portal has already been conducted, and Michelangelo's team, Michelangelo Mancuso, is currently working to further improve this. We wanted to have him today, but unfortunately he's unavailable. But we are on it. That's all I can say. As a patient organization, you can contribute to making this a reality by actively participating in the efforts and, if possible, helping to secure funding for such a patient portal. Next slide, please. The general public will have access to aggregated statistics about the registry, which will be made available on a public website. The exact content of these public reports will be defined by the Steering Committee and the Data Access Committee. Examples of what could be published include the total number of patients in the registry categorized by disease group, the proportion of patients in the registry by country, and the average time from symptom onset to diagnosis for the most common disorders. Additionally, the results of research based on data from the EURO-NMD registry will be communicated through various channels, including the registry's website, conferences, and publications in scientific journals. Next slide. As of now, the EURO-NMD registry has 4 fully prepared healthcare providers that are ready to register patients. The centers are located in Paris, Nijmegen, Riga, and Athens. The first patient was registered on August 9th this year. Additionally, several more healthcare providers are nearing readiness to participate. The goal is to have at least 10 healthcare providers fully onboarded by the end of this year. Next slide. Patients and their families can benefit in several ways from participation in the registry. They gain access to cutting-edge research and clinical trials, which can lead to new and innovative treatments. Additionally, they have the opportunity to contribute to the broader neuromuscular disease community, helping to advance understanding and care for these conditions. Patients also benefit from improved personalized care, which is informed by insights drawn from aggregated data. And furthermore, active participation in research empowers patients, giving them a meaningful role in shaping the future of neuromuscular disease treatment and care. Next slide, please. If you're interested in getting involved, you can start by contacting your healthcare provider for more information. Additionally, you can visit the website about the registry and the Registry Hub at the listed address. And you find additional and currently more up-to-date information on the EURO-NMD website under the registry section. For further inquiries, you can also reach out via email to the contact listed here. Next slide. And now, before we move on to the Q&A, I want to mention that of course, the registry and the Registry Hub are only possible because of a huge hive mind. I want to take a moment to acknowledge the contributors and support of the individuals and organizations that made this project possible. Of course, we are grateful to the European Commission. Without their initiative, European Reference Networks on Rare Diseases would not even exist. And I also would like to thank the entire EURO-NMD network, especially Teresina Evangelista, Antonio Atalaya, Carla D'Angelo, and Hans Lochmüller. They have supported the project from the very beginning in 2020 and have repeatedly brought together the entire network and project partners to make this happen. The contributions of the teams of Radboudumc with Nawel, Lalout, and Peter Bram-de-Hoen, the Duchenne Parent Project, the Duchenne Data Foundation, Fair Data Systems, MuscleGeneTable.fr, and the European Joint Program on Rare Diseases have been invaluable. And last but not least, without the great management of the registry work package by my superiors and colleagues here in Freiburg, none of this would have been possible. So many thanks to Jan Kirschner, Sunil Rocha, and Adrian Tassoni. That's it for my part.
Thank you very much. Thank you very much, Dagmar. Thank you very much, Nawel. These were very great presentations. I think I expect we have covered a lot of topics that answers a lot of questions that patients and patient representatives may have. So I think, as we have seen, it might seem like another clinical registry. The EURO-NMD registry is not another traditional clinical registry. It's the first unified and interoperable registry for all neuromuscular diseases in Europe. So I think we have quite a lot of time for the question and answers section. So before I ask the public for their questions, maybe I can ask some of the questions that we have collected previously from the patients. And then three of the questions they will answer maybe most of the questions that patients may have, and the other three questions they will probably answer the questions that patient representatives and patient organizations may have. So, for instance, as a patient, will I have the possibility to access and modify my data? And if so, how? Also, how will my data be used and who will have access to my data? So perhaps I think, Dagmar, maybe you could try to answer those two questions, please.
Yes. So about data access for patients to the EURO-NMD registry, for now, patients will not have direct access to the system, but they have the right to request a data export from their healthcare provider at any time. And a future goal is to implement a patient portal. Actually, the platform that we're hosting the registry on offers very good support and features for surveys that could be used for patient-reported outcome measures. Currently, from my point of view, the only challenge is to define a well-functioning process to distribute the survey links to the participants, because as you know, we are not allowed to store any identifiable information directly on the registry. So we cannot store, for example, patients' email addresses there. And therefore, we need the portal to facilitate this process.
Okay.
And about data usage?
Yes.
So data usage of data stored in the EURO-NMD registry is only possible within the regulations defined by the data sharing agreement and the patient-informed consent. and only defined by as defined by the data owner, so the patients themselves. They have the option to shape their consent preferences as they wish. And then the data access committee will ensure that only the forms of data usage as defined in these documents will be done.
Okay, and so the patient organizations, they can also ask access to the data that's contained in the registry, right?
Yes, the patient organizations are among the stakeholders entitled to request registry data from the Data Access Committee.
Okay, great. And concerning the hub, so now this question is for you. If I want to create a new database, whether it is a disease specific or country specific, would it be possible to connect to the Registry Hub?
Okay, then I would say please don't. Make sure that you check if there are other registries or databases first before starting from scratch. Secondly, check the purpose. What would you like to achieve, really? Which kind of research question would you have? And then if you would like to join the hub, of course you can with whatever you have. You might have a kind of a basic database, you can even, or basic registry. And before investing a lot of money, let us know what you're trying to achieve, because maybe we might be able to help. And the starting point is doing a pilot, so we could test the feasibility technically. What do you have? What can we do? How can we support you? What's already available? We could test this with simple questions, and then we can move further with proper questions and real data. But the objective is not to make the whole registry fair or the whole data set, is just to be sure we focus on your goals and making sure we achieve those goals together.
Okay, thank you, Nawel. So, and then my last two questions, and then I will open the floor for the public. It's about in case the clinical center is not a member of the EURO-NMD or is not located in the EU, how they can participate or participate in the registry, join the hub?
Okay, so if they are not part of EURO-NMD, they can still join the Registry Hub, especially if their focus is neuromuscular diseases. So there are no restrictions as to who can join the hub. However, if it's outside the EU, then it's unfortunately not possible at this point in time, but it can maybe be discussed in the future, because we are ruled by the EU laws. So I don't know, we have to look into the legalities of whether we can connect registries outside EU, for example, US, Canada, and things like that. In the past, we've tried to have pilots, to undertake pilots, especially for Canada, registries in Canada, and we were not able to, well, we weren't successful. But in principle, yes, if let's contact us, let's look into your project and what's possible and what's not. But the beauty of having a central registry and a registry hub is that you have a few options to connect your data and to participate in meaningful research.
Thank you, Nawel. This is very useful, and hopefully things will evolve, as we know they will. So I will now start collecting the questions from the audience. We have quite a few. So we have from the anonymous person, he has asked quite a few questions. So I will start. Yes.
Maybe before we move to the questions there, because the hand of Ruf Afzai was before open. So okay. I don't know if Elizabeth can open and mute Ruf Afzai, and he can actually ask the question. Thanks.
So sorry for that.
Yes, we can see you and we can hear you if you unmute, I guess.
Yes, I think you can unmute yourself. So if you want to ask your question directly, well, maybe. Let me see if I can do, no. So who? Are you there? Do you hear? us?
I think we have to get back through.
Okay.
Till it unmutes at least.
So let me go back then to the questions from the audience. So the first question would be, is asking if there is a core data set that's needed as a registry in order to join the EURO-NMD registry. I think this question can be addressed by Dagmar. Yes, Dagmar.
Yes. So for the first phase of the EURO-NMD registry, we will ask the healthcare providers to complete the set of common data elements for rare disease registration defined by the European Commission. So this is the minimum. Of course, we have many more data items implemented in the registries, and healthcare providers are free to input more data if they are willing to and have the capacity to. You don't have to have the data already in a structured format, in digital format, because the EURO-NMD registry allows manual data entry. But of course, if you have it already in your hospital information system, it helps, because then we can explore if we can bulk import the data from your hospital information system into the registry.
Okay, and then the second question also for you, Dagmar. It's a question about PROMs. So the question is if PROMs are being collected, will be collected in the EURO-NMD registry.
Currently, as I said, the only patient-reported outcome measure that is part of the core data set defined by the European Commission is the WHO disability schedule. This is a short questionnaire about how well you can manage your daily activities and how you feel. We have that incorporated in the registry, and it's possible that your healthcare providers enters a total score only, or that they even collect all the individual answers from you and then transfer it to the system.
And then there is also a related question that I might try to answer. So the question is if there is a link with the clinical data as well to PROMs, or it's only data coming from PROMs. So I think that goes back to the question of the patient portal. So these are plans for the future, and they are the future. In the future, we want to be able to collect PROMs through this patient portal and connect the PROMs data with the clinician reported data. So that's something that we want to do for the future. And then the last question from the same person is if patients can opt in and opt out, which data they share and for which purpose, for example, clinical trials or for observational studies, pharma companies, and so on. So maybe you want to answer this one, Dagmar?
Yes. So it's possible to opt in or opt out to data usage for commercial purposes aimed to improve healthcare. So this is the definition as it's put on the patient-informed consent, and then you can tick the box or not.
Okay, great. So I hope we have answered those questions. Then the next one is Ellen Walker, and this is for you, Nawel. So she wants to know more about the FAIR in a Box 2 resource. Is this something that any registry can use to help with verification? And are there costs involved? Costs.
Yeah. So FAIR in a Box is a very simple verification solution. Yes, it can be used, it can be tested. And are there costs involved? Yes, but not as much as when we started a few years ago. Because now we know a lot more and everything is automated and easy to implement. However, the cost that you would need to take into consideration is paying for the FAIR expert to work with you, so hourly rate of his time, the training, and collaboration, and hosting services. You need to have a repository to host the FAIR metadata, FAIR data. So really minimal, and we are talking about, I won't give a figure, but it's definitely less than 3,000 euros for basic common data elements at least. But that's an absolute maximum. But we know a lot now that, and we need more registries to come forward so we can actually make these pilots happen, successful pilots happen, and then we need to transform the real FAIR data, because up to this day, the Duchenne data platform is the only registry that has transformed that data into FAIR data. All the others are still kind of work in progress, and we're working hard into motivating them. So to answer the question simply, I would say it's a very simple solution and it's worth trying it.
I don't know if I can add something on this, Nawel and Carla, that obviously a patient-driven registry is much easier for verification than any clinical registry. I think it's very simple to understand. And that's why at least we envision that let's say the hub is the connector to other type of registries that very, very few or zero, maybe other of the other ERNs can connect to, because they are limited inside the borders, let's say, of the clinical representation and the healthcare departments. Let's call it like that. Thank you. Sorry for that.
No, that's good. Yes.
Thank you both. So the next question comes from Madelon. So Madelon says that for slowly progressive NMDs in her country, you only see a neurologist at the point of diagnosis. Afterwards, you go to a rehab physician who is normally not part of the EURO-NMD. So I saw my neurologist about 20 years ago for the last time. How can I get my data in the hub?
In the hub.
Nawel. Yeah.
Sorry, I just assumed it would be for me. It's a difficult question because we need a database, a registry. We need to connect with data resources. We can't connect a patient with one specific patient's data. So if Madelon is part of a local registry, national or within the hospital, then it's possible to join the hub, but not individually, unfortunately, because also don't forget that the analysis in this federated infrastructure is generate aggregated results. We don't have names of patients or so yes, I don't know if you would like to add to this, Carla or Dimitrios.
I think from what I will ask the question to Madelon herself, but I think she's emphasizing the fact that they might not be a part of the network, but as you said well before, you don't need to be a part of the network of EURO-NMD to join the hub. So she doesn't, her data needs to be existing in another registry, and this registry needs to connect to the hub. So I don't know if Madelon, you would like to ask if this answers your question, or if you'd like to answer another question, or if it's not enough. Yes. To Madelon? Well, okay, then I asked.
The spotlight.
Yeah. She wrote it. Okay. Okay. Perfect.
Okay.
And so the last question in the chat box is from Joaquin Britz. And he's asking if the registry is related to treated MD. And I think this question can be answered by you, maybe Dimitrios.
I think that that's a very interesting question. So this is maybe one of the examples that we see in rare diseases. There are, as in the past, there were efforts, let's say, to connect and to build these registries. And one of these efforts was, and still is, let's say, treated MD. But these are, like everything else in neuromuscular and rare diseases, different pillars. Most probably, the data is the same. So, for example, in the University Hospital, for example, in Rome, I'm sure that Eugenio has the same data sets, treated MD, and inside the ERN. So they are not connected one-to-one. The main reason is that their data sets and the registries are not fair. Because if they were fair, it will be easy to connect. But this is a process, this is a continuous process. I think more and more of these registries will eventually connect. And something that I wanted to comment maybe to the previous question about the patient portal. I think this is something that was initiated even in the beginning of the discussion when we designed the Registry Hub, but also the EURO-NMD registry. And as Dagmar said, technically, we have tools to implement it. What we had to prioritize if we're going to have a registry or not. So we decided to have a registry, be able to access and collect the data and ask questions as patient organizations, maybe not as individuals. So I cannot, let's say, I cannot correct the data of my son inside the registry, but I know that I can ask questions about the other children with Duchenne. And at the same time, by collecting this data through GDPR, because the same happened with the Duchenne Hub. So we collected our data because of the GDPR from our clinicians, and then we created a patient registry. And this registry is connected. So answering maybe indirectly to Madeleine, if she has the data and they have even organization a patient registry, this is the other way to connect, because most probably we will never be able to directly access our healthcare files inside the healthcare systems in Europe. Thank you.
Okay. So I think he's fine with your question, with your answer. So we have no other questions in the chat box. Would anyone like to ask a question directly to the speakers, to me, to Demetrius, to Dagmar? Well,
and I would be interested to know if it was clear enough for them, especially the difference between the hub and the registry itself. So it could be just a comment, because we would like to know as well if we are clear enough.
yeah, that's important.
It can be yes, no, or terrible, just in the chat, guys, in the anonymous format. It's
Do
fine.
better next time.
Okay, there is another question in the meantime. Is there a link with the electronic health care record within Europe?
Not yet. But we have the new initiative about the health data. I don't know. Nawel, do you want to speak about it, or Dagmar?
Not yet. Things are ongoing. There's also the Jardin project, a new European project to implement the ERNs data at national level, or from national level to the ERNs. So all of this is new. It was launched in March this year. So there are no connections yet, but of course the objective is to make these things happen in the long term. So we are following very closely these developments.
I think also the European health data space will play a role, because at least according to the specifications we have, we will have access to our own data. So if we have the machinery as patient organizations to put them somewhere, then this can connect directly to the hub.
Mm-hmm.
Okay, then Joaquin Brits, he says the main question is how to involve HCPs. Then, of course, in this case, I don't know if you want to comment, or maybe even Joaquin, if you would like to discuss lively with us, please step forward. You can unmute yourself at any time. So unfortunately, no one said anything on the chat if the presentation was clearly enough to make a distinction between the hub and the registry. But that's a question that we can also ask in the satisfaction survey for our own our feedback.
Kim, can you hear us? Because I think he is unmuted.
Yes, I listen to you.
Super.
Hello, everybody. Good evening from Portugal for all of us. Well, my question is, I think it's the same for the other audience, because in Portugal we have some difficulties to involve all the HCPs involved in neuromuscular diseases. And I think we need some guidelines for all the HCPs in Europe for involve them in these objectives. I don't know if you agree, but it's maybe an effort, additional effort for this.
Who wants to comment on this? I think this is a very critical point. Carla, do you want to share some thoughts? I can share also some thoughts later. You are muted.
No.
Because you tried
No.
to no.
I was focused. I was focused on something else, so I could not hear the question. Sorry, Joaquin.
How we can get involved our HCPs in our registries and our neuromuscular registry is the question.
How we can get them involved?
Yeah.
Well, involved in meaning contributing with data. Yeah, I mean, some of them, they will always be very resistant, but they are accepting. Some of them are making quite a lot of effort. It needs time. It needs a lot of, there is all this legal and ethical administrative things, and this scares everyone as well. But I think when we start seeing others using the registry with time, people will get more involved. And unfortunately, we don't have much money, much financial compensation to help in this process, which of course there is also this issue of time, and time is a complicated issue with HCPs. So we will see. It's just the beginning. We just started the rollout to the HCPs. So I think the first year, our goal is to have at least 10 HCPs onboarded. And then we will see, we are learning also with this first rollout phase. And from the learnings, we will try to improve our how do I say that? Our process next year.
I don't know if I can add to Joaquin, because this is a very relevant question. I think, Joaquin, there are two different problems, let's say barriers, not problems or challenges. The one is the time challenge. So I don't have enough time to pass people inside the registry. That's a practical issue. I think our role as special organization in this can be important, because this is, for example, what we try to do also in one of the pilots. So we have somebody that will pass from the patient organization the data, let's say, to the registry. So this can be solved. I think the one that it is more difficult is the policy or the mental barrier, the mental challenge. I think for this one, also, if our patient organizations cannot persuade them, there are not a lot of that can persuade them. For this, there are ways to maneuver. The one level is that obviously, if you are part of the network, you have access to the data of the network. So if you really are important in this community and you are doing something in this community, research or care, you should be part of the network because you have access. So sharing is caring in one scenario. So this is let's say the one argument. And the other argument is what we did also in the Netherlands. So because we had this problem with the GDPR, we took in a JSON format, the files, and we created our own platform. So the moment that we can empower enough our patients to have in a digital format our data, and we as patient organizations can provide them, let's say, a hub to put them on, then this automatically or semi-automatically can connect them to the registry. So there are various pathways. It's not the same for every, obviously, pathway.
Yeah, and so we have received quite a few comments on the chat box as well. So Madelon saying it's true that HCPs, if they would join, it would not involve anything manually. And indeed, we have the hub. It does require technical work, and also the availability of technical resources at the hospital. So that's something to be considered. But we do have several options to be part of the registry, which facilitates, doesn't necessarily need to be manually. And then Victoria Castillo, she's saying that she wants how they can show to their HCPs the process to get involved, to make the process easier for the HCPs. I think the first step is really to get in contact with your HCP, talk about the registry, ask for them to be part of the registry. And yes, we do have a presentation on the steps required to be part of the registry. And that we can, of course, share afterwards. I think maybe after this presentation, this webinar, you can send in your questions if you want to, the questions you might still have about the registry or the materials you would like to have access to, and we can provide a feedback after the webinar for all of you. And yes, I think now it's 5 p.m. So maybe we can close the webinar. And as I said before, if you still have any questions, comments, but like any kind of advice, don't hesitate to contact us. We are here to support you, and we also need your support for the HCPs to get involved.
So we can connect our HCPs also to the central ERN registry, right? So we can connect it through you and through others. So we can do our prep work nationally, but I think it's even more important to help them participate in the events, because this is usually how it happens, guys. At least one of the pilots that you saw there, it was one of the clinicians that we took by a hand. We went to Paris inside the meeting. He understood, he introduced, he speak with people, he felt more comfortable, and then we moved. Sometimes you have to do it the easy way, sometimes the hard way. It's our job. Thank you very much for your time.
Thank you, everybody. Thank you, Nawel. Thank you, Dagmar.
Thank you. Bye-bye.
Thank you.
Bye-bye.
Bye-bye.